Sometimes there are complications with wound healing. Here we will discuss 5 types of complications. Hemorrhage includes any excessive amount of external bleeding from the wound, as well as internal bleeding which leads to formation of a hematoma, a collection of blood under the skin. Indications of hemorrhage include bleeding, swelling of the affected body part, pain, and changes in vital signs like decreased blood pressure and increased heart rate. The risk of hemorrhage is usually greatest in the first 24 to 48 hours following surgery or injury. Infection may also occur. Signs and symptoms include localized swelling, redness, heat, pain, fever, and purulent drainage. Infection usually occurs in a contaminated wound within 2 to 3 days, but may occur in a clean surgical wound on the 4th or 5th day. Therefore, keep a close eye on the post-surgical client. Dehiscence is a rupture or separation of one or more layers of the wound. It is most likely to occur in the inflammatory phase before large amounts of collagen have been deposited to strengthen the wound. Generally, there are other factors at play too, like poor nutritional status, inadequate closure of underlying muscle, or wound infection. If an incision begins to drain within 5 to 7 days of surgery, dehiscence is a real risk. What do you do if the wound starts to dehisce? It depends where it is located. If it is an abdominal wound, keep the client on bed rest and the head of bed at 20 degrees and the knees flexed to reduce tension on the wound. Cover the wound, call the doctor or healthcare provider, and then continue to monitor the wound. If it is elsewhere on the body, cover it, call the doc as needed, and continue to monitor the wound. The picture in the lower left shows dehiscence. In this picture, all of the layers of the skin have separated and you can see muscle tissue underneath. Evisceration is a rare complication, but it is a surgical emergency. In this case, total separation of the layers of a wound occurs and internal viscera protrude through the incision, so we are talking about an abdominal incision. What do you do in the case of evisceration? Immediately cover the wound with sterile towels or dressings that have been soaked in sterile saline solution. This prevents the organs from drying out and becoming contaminated with environmental bacteria. Keep the client in bed with knees bent and head of bed at 20 degrees. Notify the surgeon and ready the client for a surgical procedure. The picture in the lower right-hand corner shows an evisceration. You see that all the layers have separated and a piece of intestine is protruding from the opening. Finally, fistula formation is a possibility. A fistula is an abnormal passage connecting 2 body cavities or a body cavity and the skin. It is usually a result of infection. An abscess forms, which breaks down surrounding tissue, leading to the formation of an abnormal passageway or tunnel. The most common sites where fistulas form are between the gastrointestinal and genitourinary tracts. In the picture in the top right corner, you can see a fistula that has formed between the rectum or GI tract and the vagina.